Hello, everyone. It's Tuesday, September the 8th. We came in on Tuesday because yesterday we missed, Monday. We'll go Tuesday, Wednesday, and Friday this week. Regretfully, I've got to start out with we've now had 7 additional deaths since Friday. Our 244th death was an 81-year-old male in Kanawha County. Our 245th death, an 83-year-old female in Logan County. Our 246th death, a 68-year-old male in Monroe County. Our 247th death, an 86-year-old female in Kanawha County. Our 248th death, a 63-year-old female from Kanawha County. Our 249th death, a 78-year-old female from Putnam County. And our 250th death in West Virginia, an 85-year-old female from Kanawha County. As we go through this, you'll see that our daily positive numbers are still high. 7 deaths since Friday is not good. It's surely better than 13 or 12 in a day, but nevertheless, it's not what we want it to be. But as we go forward, we'll just go with you and evaluate these numbers as we go forward. We have 86 new cases in the last 24 hours. We only had 1,176 new positive cases in the last 7 days. The amount of total tests that we took in the last 24 hours must not have been very many from the standpoint of we had 86 new cases, and we've been having a great many more than that. But our daily positivity rating is now at 6.02 for that day, and that's very high. The cumulative percentage of positive is 2.52. That's still pretty good. Our active cases are 2,784, and that's up from 2,344 on Friday. And our recovered cases are 8,626. The number of hospitalized patients we have is identical to Friday at 142. The county map system is Mon County is in the red. The orange counties are Kanawha, Putnam, Fayette, Monroe, Logan, Mingo, and Wayne County. Another statistic is the dead opposite of what we want to have. Our RT rating is now at 1.28, and it is the highest in the nation, which is the same as it was on Friday, the highest in the nation. So that means, we can infect others at a rate that is higher than any other state in the nation right now. Now, from the standpoint of outbreaks in our schools, we have an outbreak in 2 schools in Brook County. Our superintendent's going to tell you some great work that happened there with the local county superintendent. Those schools, Brook Middle School and Brook Intermediate North. In Kanawha County, we have 6 schools: the Ben Franklin Career Technical Center, Cedar Grove Middle School, Chamberlain Elementary, Horseman Middle School, Shoals Elementary, and Sissonville High School. All those have outbreaks, meaning that there's staff that has tested positive. Lincoln County has Duval, pre-K through 8th, and in Mason County we have Point Pleasant Primary School, and in Mingo County we have Mingo Central High School. And Superintendent Birch is going to talk to you about that in just a few minutes. I want to go back, I want to touch on, a thing that happened just, last week, and which I think was terrific, and it's something that we want to continue to do in every way, and that is we had a bipartisan effort. Just one second. Excuse me. We had a bipartisan effort in regard to broadband. A great thing happened, where we had, our treasurer, John Perdue, and we had our auditor, J.B. McCuskey, and we had so many legislatures from both sides of the aisle, and everybody pulling the rope together, and that's what we should do as West Virginians. That's what I've said from day one. We don't need to be Democrats and Republicans and independents. We need to be West Virginians and pull the rope together, and lo and behold, look what we've got going on with broadband across this state. I don't know how it could possibly be any better, and you'll see, coming up on bid dates in October, we want to encourage all these companies, and the other thing is, we've got several small companies now that have signed up, and not small companies, but smaller companies and the big giant companies, and have signed up and trying to make themselves eligible for this bidding. So that's really good. And so a great day in regard to that. And if I could just make one more observation, I'll keep going with this. Right now we've got 34 outbreaks in our long-term care facilities. Our churches, we have 5, that's up from 3. We have a new church in Kanawha County. We have a church in Wayne County, Monroe, Cabell, and Wyoming counties. So we still need to encourage everyone to please be super safe at the church settings. This is tough enough. There's things that are cropping up all over the place, and whether it be at a church, and we're going back to school, and we surely want our schools and all of our teachers and service personnel and all of our kids, safe and everything. So you got to help us in every way here. I mean, we're in an absolute war that we're trying to fight with this invisible killer and get us to the point in time where we have that vaccine. I don't think we're too terribly far away now, but in my heart, I still believe it's a few months away. So anyway, from our church community, please, please, please really try to help us there. From our corrections, we have no inmate new cases over the weekend. At Mount Olive, there are 134 positive inmates there. At the South Central Jail, we now have 1 active case there. At the Western Regional Jail, we have 1 active case there. And the National Guard continues to sanitize South Central Regional Jail. The National Guard is doing great work, and as well as corrections there. From the standpoint of our small business grants, they're going along good. We still got the $12 million out. We're still, taking in applications. We want sole proprietors to continue to apply. We're trying like crazy to get more and more dollars out. So continue to apply. That runs out on September the 30th. We got to get you in if we're going to be able to send you the money. From the cities and the counties, we're at 191 cities and counties have applied now. We're a little over $104 million that have been sent out. We encourage you again to continue to apply. We'll continue to send the money out just as fast as we can possibly get you checked out and through all the wickets to make sure it's all right and everything, and then we send the money. Our free testing is going on today in Logan County. Tomorrow we're going to be in Mason, Mingo, and Morgan counties. This weekend we'll be in Cabell, Mercer, Raleigh, and Wayne counties. And please, especially the minorities, but anyone that has any anxiety, anything whatsoever, any kind of feeling that you think you want to get tested, it's free, it's painless, it'll give us more and more information. We've now completed 462,547 tests. So go get tested. Please go get tested. Our food assistance map is up. If you've got any problem with trying to find a place where you can get food, please call 211. We have 696 sites. We sure don't want a West Virginian going hungry. Every time I see this, this just tickles me to death, brings a big smile on my face. In regard to our census, we have now got that 97.1% of our residents have been counted so far. You can't fathom how much that will mean to West Virginia as we go forward. And by doing that, I can never thank the people, the team leaders, the community captains, the street captains, all the people that work so hard to get that done. We're still a little behind Iowa. You've got to, try to push it across the finish line. I think this all ends on September the 30th, but my goodness, is that good. That's a wonderful, wonderful number, and great job, West Virginia. You know, in regard to school openings, I'm gonna defer to our Superintendent Birch on that, you know, in just a few moments, but I think you're going to hear a lot of good stuff. You know, the biggest thing is just this. Do you realize it's been 179 days since I shut the schools down? 179 days that our kids have been without their teachers and their supervisors and their principals and all the people that are with them and impacting them in every way. Now, I know we've done great work as parents and grandparents and whatever it may be. I know that. But 179 days that our kids have been out of school. And so today is a really, really important day. Now, we want to continue to push to keep everyone just as safe as we possibly can. But our kids need to go to school. And I can't thank our teachers and service personnel and all those that are making this happen, from our superintendents, principals, all the people, state board, state office, everybody that's making this a reality and everything. And I'll let our superintendent talk with you about that. On Saturday, we went over the coding of, the color coding of these counties like crazy. I was on the call myself. You had a multitude of people on the call. You know, all the panel was on the call. All the panel was weighing in. And I'm talking about there was probably a dozen or more people that are on the panel that were, that were all weighing in and giving their opinion on certain things. We did tweak one thing. We moved Monroe County from the red into the orange, and we did that because we felt like that Monroe County was trending in the right way, and so much emphasis was put on the nursing home facilities there, and so we moved Monroe County into the orange. We're very, very hopeful that Monroe County is going to get in the yellow and then back in the green. So again, like I said, I'm going to let our Superintendent Birch talk to you more about that in just one second. How about this? We as of today, we have up and running 848 of our Kids Connect sites throughout the state. Remember, we're going to have 1,000, and we're still trying to push that right across the finish line right now. I want to take time to send out a special thanks to the Office of Technology and the Department of Ed, because these people work right through the Labor Day weekend connecting additional sites and everything. They did it almost, with no notice whatsoever, but they did it, and they did it in record time. We don't quite have 1,000, but we're going to go past 1,000, but we've got 848 sites that are connected right now. Great work, people. And so really and truly, that's all I have. I know somebody's going to bring up, that we had a out-of-state baseball thing going on in Kanawha County over the weekend. I sent, when it came to my attention, Sherry Young, Dr. Amjad, and Alan McVeigh and Secretary Crouch all went there, visited it, checked it out, looked at the people, looked how they were spaced out and everything else. To be perfectly honest, their report came back to me that things weren't all that bad, but I would just encourage everyone to just know this. From the standpoint of an out-of-state sporting event like that, I don't know if we should be doing that. I mean, really and truly, that call, I guess, came from the Kanawha County officials and everything, and they made the call. I surely didn't know anything about it until I heard a complaint, that people were down there. So I sent the Kanawha County health official, I sent Secretary Crouch and Alan McVeigh. They all went and checked it out and called back and said they felt like it was okay when they were there. But I'd say this, from the standpoint of us using good judgment, especially in Kanawha County when we knew we were going to probably end up orange, and maybe not be able to, well, in fact, not end up being able to go back to school. I mean, the optics for that is terrible, and you know, I don't know that we ought to be doing that. I mean, that doesn't make a bit of sense in the world to me. But not my call, but we went down and checked it out, and we're going to try to stay on top of everything and keep doing the best job that can be done. Thank y'all.
All right, thank you, Governor. Let's now go first to Clayton Birch, our West Virginia Superintendent of Schools.
Thank you, Governor. So 179 days, as the Governor said, since our children were in school, and we celebrated today 46 counties that were able to open up in person. As a matter of fact, I myself left just a little bit early to follow that first of the year bus run down Route 60 from my house. And I wanted to see just how different it was. And watching the children get on with their mask, and knowing that our bus drivers have been preparing, as well as our cafeteria workers, all service personnel, teachers, to make this day happen. We've said from the beginning, our children need to be in school. Nobody argues that point. They really do need these teachers, and our parents have been very, very vocal about wanting to be in person. So again, 46 out of 55 counties opening up in person today. Over the weekend, as the Governor said about Kids Connect, they were there all weekend long working the entire holiday weekend. My staff was there entering registration for virtual school. We did some interviews yesterday to talk about what opening school looks like. Superintendents have been texting me throughout the day about how it's going. I think they're all very, very excited to have children back in school finally. So the other thing it was nice to see is that here, and I'll use an example in Kanawha County, that we said that meals would be served and delivered regardless of the remote. So if you're in person, you're virtual, and in the 9 counties that couldn't start in person, knowing that meals are being delivered to those children was very, very important to us. So I was glad to hear some positive news that we saw buses running, delivering meals. So proud of them. We also know that even though I'm celebrating today, we wanted the children to be back in my own county where my own children attend. I know they were disappointed they wanted to be in school. They're starting remote this week, and the youngest was a little disappointed, and I did remind him, as he and his brothers go out into the public, that they actually play a role in getting back in school. Wear your mask. Get the numbers down so your community is safe so these schools can open. That's been my message all weekend long. I also want to send out a thank you, though, to a few superintendents out there over the weekend. And this thank you is not only to Jeff Crook in Brook County, Don Spence in Mingo County, Jeff Kelly in Lincoln County, and Tom Williams here in Kanawha County. These superintendents worked over the weekend with their local health department, and Dr. Amjad. She worked all weekend long to assist these superintendents in making decisions about individual schools, following the protocol if somebody tests positive, doing the contact tracing, quarantining those that need, and really making a decision if it impacted the school to where it wasn't safe to open. So those superintendents did exactly what we hoped would happen, working hand in hand with their local health department, and having Dr. Amjad there as our safety net to facilitate that just worked out excellent. So that is a very, very special thank you to Dr. Amjad. Leading up this week, I'll end with, I know we'll be looking at the Saturday map again, and I am getting parents that will ask me, you know, it seems like a surprise to wait till Saturday, and again, please, I encourage everybody, look at the DHHR's County Alert System. It's posted daily. I know that we have an expert panel that's going to review that Friday and Saturday. Just as the Governor said, they did a great job doing that for us this week to get everything in order to post. But we definitely want everybody trending in the right direction. So encourage you to look at that map and thank DHHR and the expert panel that the Governor led to help us get that on time this week, and it did go very, very well. So thank you.
Superintendent Birch, thank you. Thank you so much for all that you guys in all of the areas that you work with, all that you've done. I mean, you've really, everybody has tried so hard to pull this off. Now, I want to just say this, you know, We have a few people that are outside, and they were unhappy about, the fact that their county, whether it was Kanawha or Putman or whatever, was not able to go back today because the way we outlined and set this whole thing up was just this: anybody that was in the orange or the red, we didn't want them to just start right back and potentially compound an issue that was already existing. Now, everyone needs to know one thing, and one thing loud and clear. I want our kids back in school. I want our kids back in school really bad. And I am trying with all in me to achieve just exactly that. But at the same time, we have to follow the science, and we have to follow the mathematics and everything. We don't want to do something and then look back and say it terribly compounded the issue. Now, I am so hopeful that these counties, that their situations will very quickly get down into the yellow and the green, and absolutely then we can go on and move forward in a really good and safe and prudent way. Nobody wants this more than me. I mean, for crying out loud, the greatest thing that could possibly happen is we all be back in teaching our kids and our kids learning in school, and these incidences we have are not just sprouting up all over the place. Now, we've all got to know this. We've all got to know this. I have said this over and over. This disease and this killer is still right with us. We do not have a vaccine yet, and nobody really knows for sure when we're going to have that. Now, we can make one or two decisions. We can either all go to the house and batten down the hatches, and it'll still get some of us. We can either do that, or we can find a way as best we can to manage the risk and go on about our lives. Now, our kids need to have the opportunity to be back in school, as our parents need to have the choice as to whether or not you want your kid back in school. So with all that being said, we got to know there are going to be some level of outbreaks, and we're going to have to address that. Whether it be whatever school it may be, that we've got a class that we need to separate or something like that, we've all got to know we've got to deal with that. That's all there is to it. But nobody on this end, whether it be Superintendent Birch or Jim Justice, wants anything more than all of our kids and all of our parents being able to send their kids or have the choice to send their kids to school. We're doing everything we possibly can. But I can tell you this, that if we stay red or we stay orange, I don't know how we can possibly do that and do that safely. And I do not know how we can do it from the standpoint of being on an athletic field and playing competition across county lines and everything else. I don't know how we can be doing that and playing competition and do it safely. So we've got a system in place to the betterment of all those within the county. Please, whether you're a child in school or whether you're absolutely an adult on a practice field with kids that are practicing, or whether you're going out and you're going into a store, Walmart, or wherever it may be, wear your mask. Wear your mask. There are those that are out there that says, well, that's our right. We don't have to wear a mask and everything. Well, it is also all of our right. It is also all of our right that we are protected from one another, passing this dreaded disease right on to each other. 250 West Virginians dead. Approaching 200,000 Americans dead. Serious stuff. Everyone is doing all that they can possibly do, but absolutely, to be demonstrating that I, am and holding them back from being in school, that's ridiculous. At the end of the day, I want them in school so bad it's unbelievable. And but from the standpoint of our color codes and everything else, I think we've got a great system in place, and that's the system we're going to go with. Thank you.
All right, thank you, Governor. Let's next go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. As the governor has articulated and as Superintendent Birch has articulated, our goal is to get our children back in school safely, get our teachers and our staff back in school safely. And part of that ensuring safety for our school teachers and children and staff is controlling community spread of COVID-19. Remember the map that we are asking all of our schools and our guidance through Secretary or Superintendent Birch is around the public health of the counties. And we know that the single best predictor of safety for schools is the limited rate of spread of COVID-19 in those counties. And as we look at those counties, as the governor and Superintendent Birch have articulated, we know that we have some counties in orange, which mean they have a rate of spread between 10 and 25 new cases per day on a rolling 7-day average is corrected for 100,000 population. And we are worried if we start school in those counties that the schools may immediately have to shut down, and we may see spread of COVID-19 within the schools. We also know that red, which is over 25 new cases of COVID-19 daily on a 7-day rolling average corrected for 100,000 population, as we see in Mon County, is a sign that COVID-19 in that community, in that county, is not being controlled. The rate of spread is not being controlled. And as evidence that we haven't been able to control the rate of spread, not only in these counties, but also in our state, the governor communicated and shared that our RT value, the reproductive score that talks about how fast a single person with COVID can spread to somebody else, we have the highest rate in the nation. And we have the highest rate in the nation now for about the last 3 or 4 days, which really is consistent with what we have seen as far as the new cases per day sort of picking up for us. And the governor challenged us, and I would as well, that it is really, really important not only to wear your mask and physically distance, but also to avoid the 3 C's, avoid crowds, avoid crowded indoor spaces, and avoid close constant contact to people that you don't live with, 6 feet or less. And we know that as we get our schools back in session in the counties that have the appropriate control of COVID-19, that's going to be a very tricky proposition. To live with COVID-19 and to be able to manage the classroom environment, to manage with the number of people that will come into contact is going to be a great challenge for each of us in the state of West Virginia. And as evidence of that, West Virginia University, I think, made the very brave decision to take a time out for a few weeks to try to get the rate of spread of COVID-19 reduced in their student population, which also is really beneficial to Morgantown and to Mon County, which is our only red county, so that we can try not only to help West Virginia University stay in session, but also that we can start to reduce that rate of spread so we can help Mon County get back in session as well. And as we navigate these real challenges, perhaps the most difficult challenges that we've faced and tried to work on together the whole time that COVID-19 has been with us, it is really important that we call on each of you, no matter how old you are, no matter what position you have, to really protect yourself. Because remember, increasing the rate of COVID spread, even among people who may not be as deeply or severely affected, although we know young people can be very severely affected by COVID-19, but even young people spreading it will lead to more community activity, which will eventually cause the infection of people that are very vulnerable. So to protect yourself, to protect each other, to protect our schools, to allow our schools to open, our children to get the education and the help that they need, West Virginia, it's really time to show your mettle, to work together, to show your altruism, to show your love for each other, to show your love for this great state, and wear your mask, stay physically distanced, mind the 3 C's, and work together, stay together, so that we can start to see that reduction in the rate of spread, and we can get back to the things that we love. So thank you so much.
Dr. Marsh, thank you a bunch. And I just want to add just a couple things to this and everything. You know, over the weekend, I met personally with President Gordon Gee, and I think Gordon's doing a marvelous job. You know, he, as myself, you know, we've been advocates to come back to school, but yet, you know, President Gee was very disappointed about what went on at either a fraternity or a sorority house, and he said, you know, that there was discipline on the way on that issue. I know there were certain kids that were disciplined. You know, I think there's 20-some kids that were disciplined, and I know the situation we got into where we had a scheduled date. You know, in Mon County, we had a scheduled date that we were going to reopen our businesses and reopen the bars that I'm referring to. And lo and behold, what did we do? Right out of the get-go, we did exactly what we shouldn't do. We had the same kind of gatherings. We did not have any masks. We did not have the distancing and everything else. And lo and behold, what do we have? We have a situation in Mon County where we're red. Of all places, we're red in Mon County, and that's not good. So I commend Dr. Gee. Dr. Gee is trying every way that he possibly can to minimize the impact over the greatness that the university brings to Mon County. You know, that university brings unbelievable greatness within that county, but we know by the greatness there's numbers, and President Gee is trying every way he possibly can to minimize the situation and to absolutely help in every way to getting Mon County back in the yellow and back in the green. Now I would just tell you just this. I don't know how many times we've said this, West Virginia, but you got to listen to me just 1 second. We have told you 1,000,000 times that we're the oldest state, the most vulnerable state, the state with the most illnesses, the state with the most breathing problems, the state that is located with border states all the way around you. Now, you've done great. You've done absolutely, without any question, great. But we have also told you to wear your mask. Wear your mask. And there's still some that just are not wearing their mask. We have told you don't go to Myrtle Beach. And if you go to Myrtle Beach, then at least come back and get tested. And what did we do? We went to Myrtle Beach and we brought stuff back that was not good. You know, what I am saying to you as West Virginia is just this. You know, if we're going to get through this, and especially we're going to be able to get our kids back in school, please listen to what all these health experts are saying, because they're not telling you something to penalize you. They're telling you something to where West Virginians can live as close to normal as we can possibly live with this pandemic. So West Virginians, you've done great. You've done absolutely great. We've stayed together. Keep pulling the rope together and we'll get through this. We are the most exposed of the most exposed. And this thing can get way worse than it is right now in West Virginia. Please, West Virginia, listen to us. Listen to us about trying to protect your grandmas and granddads. Please, West Virginia, listen to us about your mask. And please do everything you possibly can to keep us and yourself safe. We'll get through it. We'll get through it, but we're still not there. And this thing's got to turn and start getting better and getting better quick. So anyway, thank you so much, and thank you, Gordon Gee, for doing what you did, sir. And you know, I'm very hopeful that we're going to be back, you know, in classrooms at WVU soon. And I'm hopeful that we're going to be in all of our classrooms across our state. And more so than that, I'm very, very hopeful that I don't have to come in here and sit and read off the number of deaths. So God bless you for what you're doing, but we still got a ways to go.
All right, thank you, Governor. Secretary Bill Crouch from the West Virginia DHHR and Dr. Ayn Amjad, our state health officer, are also joining us today and are available for questions. Major General Hoyer with the West Virginia National Guard had a prior engagement today, but he will join us again tomorrow. We'll now go to questions from members of the media. Our first today is from Steve Adams with Ogden Newspapers.
Yes, hello, Steve Adams of Ogden Newspapers here. My question is this: I know we hear an awful lot about Monongalia County for obvious reasons, with the college up there and number of cases. But I'm curious about Kanawha County, because Kanawha County at this point has the most cases. Now, of course, there's a larger population here, even larger than Monongalia County with WVU students. But my question is, do we know exactly why it's spreading the way it is in Kanawha County? And what are we doing here or thinking about doing here? Obviously, we closed the bars in Monongalia County. That hasn't happened down here. I can only presume that's because you don't think that's really kind of where the spread's coming from. But I've been curious now for a while why Kanawha County's been kind of going gangbusters other than just the population issue. There's just more people here. Can somebody explain that? Thank you.
Stephen, I'm going to pass this to Secretary Crouch and Dr. Amjad. They'll answer it a lot better than I, but I think you've just, you've got population, you've got many different nursing homes, you've got an issue that is county spread and or county wide. And so, Dr. Amjad, or Secretary Crouch, if y'all answer it, please.
Sure. Steve, I can answer some of that. We have, part of it is the large county that Kanawha County does serve, but we also have, just looking at it, our outbreak report, we have, I think, about 12 nursing homes. We have several church outbreaks. We had the most recent one over the long weekend, but the nursing home population in itself is over 12. Just looking at our report right now, the jail with the staff outbreak, we have a police department with 13 staff. So the nursing home population itself is a large one, with the staff being a part of that system and that. But the Kanawha County resident population is huge, and that is partly why we're having a large number in Kanawha County. The local health department and its staff is working very hard to control that. We're in touch with them several times a day, but that is why Kanawha County is having the situation that you're referring to.
And Steve, let me add to that. This is Bill Crouch. I did go down to the ball field as the governor asked yesterday, and there weren't huge crowds, but I didn't see a lot of masks. We have folks traveling throughout the state in terms of kind of watching and to see what's going on with regard to the use of masks. And as the governor says, and as Clay says, that's critical. That's what keeps our numbers down. That's our vaccine right now. So part of the reason, and I want to say that Dr. Young, Sherry Young, is doing a terrific job running to these situations just as we are, and trying to tackle the situation in Kanawha County and trying to make sure that people understand you have to wear a mask, and we can get this color from orange down to yellow if we do that. So we're not seeing a lot of mask use out there, and that's probably the primary reason we're seeing more spread in Kanawha County.
All right, thank you, Steve. Next, we'll go to.
Let me say this. In Kanawha County, I know we've got a big population, but we adjust to the population. The problem is just this too, is with a big population, if you're adjusting, the numbers, then it ought to all work out to how we're working, with counties that have a lesser population. If we recognize this, with a larger population, that means we can be together more. And if we're together more, we've got to be able to do the things to protect us more than, a population that is not together. And so just the mere fact that it is a bigger population, we adjust for that in the number of the color coding, but we have got to realize that if we're together more, we sure got to wear a mask and protect us more. And that's what Kanawha County is. I mean, it's our biggest county. We've got a lot of people. And so therefore, the odds of us being together more, and if we don't take the proper precautions, we get more and more cases.
All right, thank you, Steve. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. Hearing a lot of people who are not only inconvenienced by school not being open, but are in dire straits in some circumstances because childcare is a real issue for them, especially where daycare centers have gone out of business or are not serving clients right now. So, I mean, what do we have to offer these people, Governor? Just encouraging words and hang in there and we're doing the best we can, because you literally have single parent homes, grandparents who work, and also moms and dads who work and have nowhere to take their kids. So in light of that, and I know that it's important to make sure that you don't spread this thing and you have to have some type of system, but is there anything that can be done for these people, or is it just good luck till we open the doors? Thank you.
Kenny, I get it with all in me. You know me well enough to know that. I get it, and we're working it as best we possibly can. I mean, for crying out loud, I know with all in me that our parents want our kids back in school, and they have a need. They have an economic need. They have every kind of need for the child. But I get it. I get it with all in me. Now, the problem is just as simple as this. If our health experts deem us by a color code system or whatever it may be, that it is not safe to go back to school in this situation because it could compound the problem, what do? Do you look at an alternative source from economics to be able to help the parents, that are in the healthcare situations that need, not healthcare, but need, some kind of place, whether it be nursery schools or whatever it may be, to be able to have your child go there, but if you have your child go there, it falls right back on from the standpoint of, well, then why not be in school? And so there's so many different factors to weigh here. All I can possibly do is listen to the experts, listen to the medical community, listen to our educators. From the standpoint of just this, if we said, oh, well, forget everything, let's just put everybody back in school. And then if tomorrow there are situations that cropped up all over the place where really and truly it could be devastating, then what are we going to do? What are we going to say? So it is a very, very bad situation. I understand wholeheartedly that people have got to work. I also understand wholeheartedly that you're going to let them know on Saturday night at 9 o'clock, and they've got to adjust to that on Monday normally. I know that. I know how tough that is. But from the standpoint of what day you tell them, it impacts over and over and over lots and lots of different systems. And so everybody has come to the point in time where everybody says Saturday's the best way to go. I would just say this too. Now, stay with me on one thing. We should have had the last stimulus package passed from Congress, and it should have happened in early August. Early August, when they first came back in. And what happened? It turned into just what Washington is all the time. A political football, nothing but that. It became absolutely nothing but just a mockery. And then the House decided, just out of clear blue nowhere, they're going to adjourn until Labor Day. And so now they're finally back. We could have had those dollars and been doing so much more for so many more and everything, but we just, it just didn't happen. And so as they continue to do that, you know, they'll finally get to that package at some point in time, and they'll finally come to some level of something, you know, that will help us with child care and everything, but it should have been done in early August. That's all there is to it. I get it, and we're trying to figure out what to do in every way, and I don't have a good answer. I just don't. I know I don't.
All right, thank you, Kenny. Next, we'll go to Brad Mcelhinney with West Virginia Metro News.
Hi, Governor. Hi, Superintendent. Hi, everyone. I have some questions passed on to me via social media from some moms. You might want to get your whiteboard ready. I'm going to read them here. Please ask him why his color-coded map doesn't have more factors. How is it stopping the spread? Isn't it discouraging testing? Punishes counties that test, only affecting kids while life rages on. Using them as a carrot, the kids, is improper. From another mom via social media, ask him then why the churches are still open. He just discussed all the outbreaks. Why are they picking on schools? Why not close gyms, churches, casinos, and daycares? Governor, any response to moms and dads who may be frustrated, confused, and stressed today? Thank you.
Well, Brad, I'm not going to dodge the question and pass it on, you know, to our experts and all that kind of stuff, but I am going to have them follow up, but you know, Brad, all their questions are legitimate questions, you know, from the standpoint of our schools and our children and our teachers, our service personnel, and all those. There's been so many factors that have gone into making these decisions and making up this system of color coding. You know, if we were just to say, you know, well, we know there's X number of cases in, let's say, Kanawha or Mon County or whatever it may be, and we're going to just go back to school. And then we get into a situation tomorrow, you know, that the teachers decide we don't want to go back to school. And before you know it, it's just one thing after another, after another, after another. And so within all that, these ladies that you're talking about, these moms, you know, they're right on everything except one thing, and that is holding these children as pawns in a game is ridiculous. That's absolutely the silliest thing in the world. Nobody wants to go back to school more than I do. That's all there is to it. Nobody wants to give our parents choice on what they can do more than I do. Now, like it or not like it, believe it or not believe it, that is the God's truth. And so now in that, you have got to be able to defer to experts that tell you things that you aren't qualified to know. I don't know the medical field or the education field as well as our experts do. They have all the input to tell us and structure how we can best protect and best get our kids back in school. You know, so with all that being said, maybe Dr. Marsh, you'd like to weigh in, you know, on some of the aspects of Brad's questions from these moms, but they're good questions, but if Dr. Marsh, you'd like to weigh in.
Thank you, Governor, and thanks, Brad, for the questions. I agree wholeheartedly that this is, as we've said, an unprecedented time, and we can't easily use patterns that we have used in the past to try to address COVID-19. What I would say is that the map that we have published is not really a school map, it's really a public health map. And what we know is that the more that we control the spread of COVID-19 in our communities, the safer it is for all aspects of our life that include school, but are not only limited to school, include interacting with each other, include the events that we want to attend. The questions about whether other businesses or other entities should close similarly is really, I think, based on what we have said for a very long time, that we need to treat each county as a separate entity that together the 55 counties make up the state. So instead of using a hammer to sort of shut everything down, what we're really trying to do is understand with our local health departments and our epidemiology folks, with the contact tracings, what are those key elements in a particular community that may be at the root of increasing spread. And we've talked a lot about the congregate settings, talked about our long-term care facilities and other congregate settings. I think the issue about churches is a challenging one, as the governor said many times, allowing people to come together to celebrate and to be together related to their spiritual choosing is a really sacred right that we want to preserve. But we have really provided very strong and clear guidance for the safe opening of churches. Certainly that's something I think that if in a county that we saw was a main driver, we would then have to act along with the local experts, with the parishioners and with the folks of the head of these entities like churches or other businesses. In Mon County, we traced a lot of activity before to bars, and the governor did close the bars and reopened and then had more problems and then closed the bars again. So we are really trying to be very precise about what we do, but this is really not holding anybody hostage. In fact, in my opinion, it's really quite the opposite. It's trying to make sure that we are doing everything we can to facilitate getting our children back in class. As Superintendent Birch has said, there are programs like for special needs children, for other types of special activities, for food and meals and structure, that in person is really the only way that some of this can be delivered. But we don't want to, and the governor has been very clear that if it's not safe, if we don't feel like it's safe for all involved, then we're not going to do it. Because we want to make sure that our children, our teachers, our staff, essential personnel that work in the schools are able to do their job safely, and that we're providing that best environment for them. So thank you.
All right, thank you.
Just a second, please. I hope everyone knows this, but from way back in early March, on day one, I hope you know that we, as West Virginians, me as your governor, and all of us, we did, by the grace of God, push the right buttons with your help. And along the way, I hope to goodness that everyone understands wholeheartedly that I want our kids back in school just as much as every single last person does out there. I hope that you understand, too, that I totally understand from a daycare standpoint or whatever, that how important it is that our schools be back. And I hope you understand how important that it is for our children to have the ability to be back with their friends and their teachers and to be able to learn. But at the same time, I want to say this again to the mothers that just called in and everything. I hear you, and your input is valuable to us. Because this situation, I have said so many times, there's no playbook. There's no playbook. And what do? We adjust as we go. And so your input is very meaningful, and it's good. And I hear it. And we're going to continue to work and continue to tweak and continue to do things that enable us to make this system better and better and better. So keep giving us your input, because it's valuable to us. And I don't resent that at all. I think it is absolutely good stuff and valuable. So thank you so much.
All right, thank you, Brad. Next, we'll go to Amanda Barron with WSAZ.
Hi, everybody. Amanda Barron with WSAZ. Obviously, this week with school is going to be a lot of figuring things out logistically and working out the kinks of a new and unusual school year. Obviously, though, there's a lot of catching up to do. So how are teachers starting the year and doing the necessary relearning, but also working to get them up to speed and kind of hit fast forward to get them where they need to be after being out of school as many days as a typical school year would be?
That's Superintendent Birch. He's going to answer.
So great question, Amanda. And we've been talking from day one that there was going to be issues starting school and playing that catch-up game. We all know that there's typically a summer slide. This summer slide has been, as the governor said, almost 179 days. So the teachers knew coming back to school that they were going to have to tackle the issues around assessing where the children were. But I'll tell you, more times than not, what we've heard teachers say that out of the gate, they were preparing for the first weeks of school to get back into structures, routines, assess social, emotional, and any trauma that we've continued to talk about. So, I felt really, really good knowing that our teachers had to juggle many things coming back to school. But I think that each of them were prepared that they're going to have to begin the school year differently. And I think that means not only assessing any learning gap in the way they start, but also really assessing that social emotional needs that our children have.
All right, thank you, Amanda. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I wanted to know about the Kids Connect initiative. Is that a long-term program that you see students being able to utilize for years to come, or is that just a stopgap measure for this current school year? Thank you.
Well, Charles, it's both. To just tell it like it is, it was a stopgap to start. Because we had many kids that had no ability to go online. And this gave many of our kids across our state the opportunity to go somewhere and be able to pull lesson plans up or whatever it may be. But at the end, these facilities are going to be there, and they're going to be there forever. So they can be used, they can be improved upon. There's lots and lots of things that can be done there. But in addition to that, with the announcement that we made, in that really bipartisan way that I loved more than anything the other day in regard to broadband, just think about it. We have the opportunity to blanket our state, to do something with broadband that absolutely can make broadband come to all of us. Now, in doing so, we're making giant steps. We're not making baby steps here. We made a giant step with the broadband initiative that we talked about, the $766 million coming to our state. Now, in addition to that, we've got $50 million parked over in the CARES money that can add to getting more broadband into areas that we're not covering by this initiative. But absolutely, Charles, it's long term from the standpoint that they'll be there and they'll give us that flexibility as we go forward. It's a stopgap in that it is an initiative that we got done for the most part by September the 8th, and we're up and going, and we're finishing it up, but we've got 848 sites up and going. So it's a stopgap and it's long term, but in addition to that, this broadband initiative that we got done by that incredible bipartisan effort and everything, I was so happy and so proud of that and everything. But by getting that done like that, that is a huge step towards covering so many of our homes. I think, that they said 121,000 homes in West Virginia that do not have any level of broadband access today, and then on top of that, the $50 million in additional CARES money, so yeah, this one is, sir, do you like your eggs scrambled or fried? And the answer is yes. When you say, is this long term or is it a stopgap? It's both. And so I think we're better for it. That's for sure.
All right, thank you, Charles. Next, we'll go to Ryan Quinn with the Charleston Gazette-Mail.
Hey, I think the governor used the term outbreak when announcing cases in schools in Kanawha, Brook, and Lincoln. Can you please specify how many people have positive cases in these particular schools? how many cases in each school are students and staff? And since you said last week that you will report every school-related case at these briefings, could you please provide that level of specificity in the future at each briefing? Again, school name, number of cases, and number specifically among students and staff.
And this was, Ryan, is that correct? Ryan, I don't have the number of cases, but what I have is a note that says a school outbreak, and let's use Brook County, for instance, and everything, where a whole lot of really good work was done by the superintendent. I think Dr. Amjad and everybody over the weekend, but like at Brook Middle School, I don't know this, but if we have one positive case from, a teacher or service personnel that works at Brook Middle, they're listed here. Now, I don't have the number, but that's how it's reported. And so if we have, like in Kanawha County, we've got 4 places, 4 different, from the Ben Franklin Career and Technical Center all the way down through Sissonville High School. And if we have one person there, then we list it here. But I'll get you the numbers and everything, and we'll be able to report that as we go forward, but I don't have them today.
All right, thank you, Ryan. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, Governor and Cabinet. Mark Curtis, Nexstar Media. We're getting an alarming number of calls. I don't have an exact number, but we're getting an alarming number of calls and emails to our newsroom about people who are being evicted from their apartments. And of course, they all say that if they have the supplemental unemployment from Congress and the state, they might be able to stave this off. But what can you do to stop, if anything, the large number of evictions we're starting to see, especially here in Kanawha County?
Okay, Mark, here's what I've said, and if you can go back and you'll listen to my words. I've said from a landlord standpoint, evicting good people is the wrong thing to do. Now, I understand you got a business to run and you got things you have to do, and but evicting people is plain the wrong thing to do. The President of the United States put out an order that said you can't do this. But and in the second part of your question, you asked, well, if they had their unemployment benefits and everything, there are 300 and there are 100 coming from the state. If they had that in hand, maybe they wouldn't be in a situation to where they would be facing that level of eviction. Now, so I will promise you again, I will do this. I am sure that Scott Adkins and Workforce is working this as diligently as they possibly can to get that money out. But I'll go back and absolutely promise you that by tomorrow, when I come in tomorrow, I'll have a better feel for just how hard that they're pushing this. I hope to goodness that I know they're pushing it as hard as they possibly can. But if they need additional help and whatever to be able to get this out the door, we'll put in whatever resources we have to have there to be able to get these dollars out the door right now.
All right, thank you, Mark. Next, let's go to Taylor Stuck with the Herald-Dispatch.
Hi, everyone. This is probably for the health experts. How long will it be before we see kind of the impact that Labor Day weekend had? Cabell County, on top of Labor Day weekend, also had some tailgating, not on campus, but off campus. There was still some tailgating. So how long will it be before we see any potential effects of that? And have any counties reached out to the state to say, like, hey, maybe this is, keep an eye on us because we might be seeing an influx just by what we observed?
Dr. Amjad, maybe you can try this, or Bill.
Sure.
I know y'all can answer it better than I.
Sure. Hi, Taylor. So usually we see maybe results within a week or so, depending on how many community testing events we have, but I would expect to see our results within a week or so. So that's why before the Labor Day weekend, we were really encouraging people to wear masks or really not go out of town. We really wanted people to stay home with their families and not go out of town for the long weekend. But usually within a week to 2 weeks, we'll start seeing any results with our community-based testing. But that would be what we would expect.
All right, thank you, Taylor. Next, we'll go to Dave Mistich with West Virginia Public Broadcasting.
Hi, everyone. My question is about the school reopening metrics. I understand. I'm going to pull this up so I'm reading it exactly. At the bottom of that page, it says the protocols set forth on this page will be in effect so long as the state as a whole remains below a 5% positivity rate based on a 7-day rolling basis. Right now, we're above 6, which leads me to believe that, in the coming days that we may be above 5% on a 7-day rolling basis. What would be the change to this policy and protocols, and when can we expect something to change if it does go above that number?
And this was Paul, is that correct?
Dave,
I'm sorry. Dave, is Dr. Marsh still on the call? Okay, I think Dr. Marsh had to go and dropped off the call, but let me answer this in his absence as best I can. A rolling 7-day average in excess of 5% causes all kinds of difficulties and everything. I hope and pray we're not going to get into that situation. I do realize that today we have a day that is in that situation and everything, but I think if Dr. Amjad, if you want to weigh in and everything, but the cumulative number that we have today is at 2.52, but that is not the 7-day rolling average. But Dr. Amjad, if you want to add something to that, but Dave, I do not think we're going to have a 7-day rolling average in excess of 5%. But, that was one of the teachers' organizations came up with that long ago. We tried to abide by, following just in that footsteps. But Dr. Amjad, if you'd like to add something.
Sure. Yes, the 5% is for the number that you're seeing on our DHHR dashboard is for 7 days. So that's looking for the previous 7 days. So we'll want to look at the numbers coming up over the next days looking forward. But looking at that's the previous 7 days. But then we also look at the county level in addition to that. So we'll want to look at the next couple of days moving forward with the results from the previous last few days. So that is, looking back 7 days, but the 5% is the first thing that we look at on a metric level. Then we also look down at the county level as well, looking forward. But I don't know if Bill wants to add more to that.
Yeah, thank you, Dave. That's a good question, and one we've been talking about over the past week or so. One of the things, we do not have that particular calculation on the website. We're working on doing that and putting that up so that can be kind of a companion piece to the week-long map for education and for the nursing homes. We have to exclude that congregate care, that congregate spread from that calculation. And as I've said previously, we're still working on some of this manually. We're trying to be as transparent as we can and push everything out. We have more things that we're coming out. We're working with the Department of Education on a sample calculation so that folks can pull that up and can look at how that calculation is made very great detail. Again, unless you have the data that's collected at midnight to make that calculation, it may not come out exactly the same, but we'll have that for you. And the same is true for the 7-day rolling average on the positivity rate. We need to pull that together with the exact data. That's kind of the threshold to go to the county level and go to the map. So as the governor said, we don't think we'll get to that point. We're following these numbers. That just means we're going to look at things a little harder and decide whether to make changes at that point. But we will have that data up hopefully this week. We're going to have everything ready to pull that together. I also mentioned one final point. On September 12th, we will have all of the counties in West Virginia onto our new surveillance system, onto the checks out system. So part of our issue here is we're transitioning to a new system from the old WV Ed system that has been in use for years and years. So we hope to get everybody transitioned, and then things may be a little easier for us in terms of alleviating some of these manual calculations. So thank you for the question. Very good.
All right, thank you, Dave. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor, panel. Governor, you mentioned that you spent part of your weekend with President Gee at WVU. During that visit, did you have the opportunity to talk to him about the BLM stickers on the football helmets? In regard to that, were you given a heads up or consulted on that before it was announced? And what are your thoughts on it?
Well, and this is Paul, is that correct? Paul, we did not discuss that. You know, my thoughts are just really, really simple, Paul, and this is not a political answer. You know, it's just this simple. We have more of an awareness of a divide going on in this country right now, and it's not good. And we need so much to come together. Now, we all know that what's going on within our cities and so on like that, the violence and the rioting and everything is just intolerable. That's all there is to it. It's just plain awful. And to say that that's okay, man, that's not okay with me. It's just plain not okay. But from the standpoint of compassion towards one another and loving your neighbor, and absolutely some way, somehow, us as a nation, being that nation of Americans, not Republicans and Democrats, or not union and non-union, you know, not black and white, being Americans, you know, and that's what we need to be. And without any question whatsoever, I hope and pray in every way that we can each and every day become exactly what the good book tells us to do, and that is love your neighbor. Love your neighbor as you would love yourself. So please, you know, that's my feelings, and my feelings through and through.
All right, thank you, Paul. Next, we'll go to, actually, our last question today comes from David Beard with the Dominion Post.
Hi. With Mon County in the red, I know some conflicting requests came into the governor's office regarding factoring WVU into the color code metric. Some people wanted included and some people wanted excluded. And I'm familiar with the arguments for and against, but I'd like to ask the health officials who are still with us their views on that issue. And I'd like to ask the governor if you've weighed those requests or are weighing those requests and have come to a conclusion on that. Thanks.
Dave, you got to do it one more time because I missed part of it, or I can't hear part of it really well.
Okay, I'll try again. Some conflicting requests came into your office regarding factoring WVU into the color code. Some people want it included and some people don't. So I wanted to ask the health officials what they think of those requests, and ask you if you've decided or are working on a decision on that. Thanks again.
Okay, Dave, I got it now. Dave, there was surely some discussion. There was lots of evaluation, but from my standpoint, I absolutely believe that isolating WVU out, you know, and then or isolating Marshall out, or then isolating out, you know, the University of Charleston or whatever it may be. I absolutely believe that would have been a wrong thing to do. These people travel and move through our community in every way. They're part of our community. And so from the standpoint of our medical experts, we consulted and talked. We had multiple talks and everything about this issue and everything. We know the impact of WVU on Monongalia County. We got that. And from the standpoint, but we know that WVU is part of the county. I mean, and as they move throughout the county with their students, with their staff, whatever it may be, they are part of the county and everything. And so therefore, they have to be counted within the county. And so to isolate them out, I think really and truly just been a bad move. And so, but our medical experts led me in just that. And I think Dr. Marsh would be best to answer that. Maybe we'll wait on him to come in tomorrow, and he'll be able to answer that better than anybody. But from my standpoint, the right move was to keep everybody together. And I commend, President Gee in every way. I love being with him every time I'm with him because he's always stuck on, and he loves West Virginia, and he loves our students and everything. And so he's trying to do all he can do too.
All right, thank you, David. Governor, I'll turn it back to you.
Okay, I just made a, handful of notes here. I think I've covered just about everything that I know, but I do want to say just this in regard to Scott Adkins and workforce and getting the money out and everything. If they need additional help and everything, we're going to check on that as soon as we walk away from here. And if they need some additional help and everything, we're going to be, dead on that, and we'll announce anything and everything we can about that tomorrow. I want you to know this, that from the standpoint of the states that have decided to step up and send that other $100 out to all the unemployed, there's only a handful of them that did it. Most of the states are just going with the $300 and everything, and I'm very proud that we were able to do it because we had the dollars to be able to do that. I know this, that if you're one of the moms that talked about their kids not being able to go to school and the daycare and the economics, I get every single bit of it. But I also get this. I also get the fact that these medical experts and the color coding is not good today. And I also get that our daily positivity rate is at 6% today. And that's not good. And so as we go forward, as much as I pray in every way for all of us to be back in school, you've got to understand that all the numbers that we have that are coming to the medical teams and the medical experts today are of all days not good. And from my standpoint, I absolutely am not going to put our teachers and our service personnel, and God forbid our kids, in a situation that can make things even worse and could become tragic for a bunch of people. And so with all that, it's tough. It's really tough. I know it's tough on those moms, and I know it's tough from the standpoint of maybe a dad or a mom can't go to work because of daycare. I know those things are super tough. And I'll promise you, I am trying everything within me for us to be able to get through this, but I'm not going to do it at the expense of what I think would be our kids or our teachers or our service personnel if, in fact, the numbers show us that it's not the thing to do. So anyway, I thank you, and I thank all the experts, and you've got to understand that from my standpoint, I'm not a doctor. I am not a professional educator from the standpoint of the education department as much as they know. I'm going to listen to the experts, and we're going to get through this. But again, I thank you for your input, and we're going to get through this. Let's just some way stay together, and we'll get across the finish line, and we'll have that vaccine, and we'll put these ugly, ugly days behind us. Anyway, thank you so much. God bless.